So we're working on your neutral sitting posture today, and the first piece is finding the right chair for you. So this chair is good for my body because my hips are just a little bit higher than my knees. So you can think of a little bit wider than 90 degrees. But if I had a chair that was too low for my body and my knees were higher than my hips, it would tip my pelvis back into flexion, or that kind of rounded back position, which isn't going to be good for your neutral seated posture. Also, the opposite is if my feet were dangling down low and my knees were below my pelvis, it would force me into a big back extension or arch in my back. So you want to try different chairs and find the right height for you. We also then can reference your troubleshooting video that if you can't find the right chair in your house, there are ways for you to change the chair that you have so that it's right for your body. So now that you've found that chair, your hips are just slightly higher than your knees. You want to have your feet flat and comfortable hip distance apart. And we're looking for your sitting bones, or what you could think of as your bum bones, those two bony bones on the bottom of your bum. If you're comfortable, you're more than welcome to reach under and touch them. But if not, you can just give yourself a little lean or rock side to side, forward and back, and see if you can start to feel them and get a sense of where they might be pointing or aiming. Now, a little note, if your chair is too soft, again, you might not be able to feel them and you're sinking a little too far into your chair. And if your chair is too firm, it might be uncomfortable for you here, so you might need some padding or support. But here, on my sitting bones, the two bony bones on the bottom of my pelvis, they're aiming straight down right now. And I have a small little arch in my lower back. My ribs are stacked over my pelvis, and my head is just floating on top. You can think of a plumb line. Ears, shoulders, ribs, hips, similar to our standing and our lying down postures. So again, ears, shoulders, ribs, and hips. So I'm thinking of those two sitting bones, bony bones on the bottom of my pelvis, and if I rock a little forward and back, I might feel where they're pointing. So if I tip my body forward, see how the whole body moves kind of like a mast on a ship, not a bend and a flex, but if I tip forward, my sitting bones actually tip back behind me. They're kind of pointing back towards the back of the chair. And if I rock backwards, they tip forwards. I'm exaggerating this for you right now, but you can think about a mast of a ship, sitting bones aiming back, sitting bones aiming forward. So they're actually going the opposite of the direction that my body is moving in. And I want to try and find that spot where they're aiming straight down. Little arch in the lower back, ears, shoulders, ribs, hips. So here I'm in my neutral posture. Now, we can sit on the edge of our chair for some time comfortably, but if you're going to be here for a long time, you're going to want to scoot your hips back so that you can have some support, because it's a lot of work to hold yourself up here. So let's scooch back and see what that's going to look like. So if you're at the back of your chair, again, you want to check out that your hips are a little higher than your knees. You're not rounding your back and sinking down if your knees are forced up too high, depending on the angle of the seat. And again, you're not arching forward if you're way up too high here. So you want to find that feet flat, hips slightly higher than knees. But then you can see here that the shape of this chair is slightly tipping back, and I might need some support. Depending on your chair, you might be comfortably here right at the back of your chair and feeling like you can stay for some time. But in this chair, I need some pillows, so I'm going to show you that. So here I have a pillow that's supporting my lower back, my pelvis, and my ribs. And you want to make sure that you have something that when you do get tired, you're not slumping back into your chair or down, and it's not forcing you forward into an arch. So it's going to look very different for you depending on the height of your chair, the angle of your chair. You might use a rolled up tea towel, a small pillow, a big pillow, and try filling in some of the space between you and the chair so that when you are actually using it for support, you're still as close to your neutral position as you can be, and it's causing any distress in your body. There's no tightness or pain. And now that you've found that, again, it might look very different for you than it does for me right now. You're going to, again, check in plumb line of ears, shoulders, ribs, and hips, sitting bones, bum bones, aiming straight down, small little arch in the back. And you're going to start to give yourself some support, and you're going to do that with your breathing. So using your diaphragm, the muscle that creates breathing here, is going to help give you a little muscular support as well as soften some of the tension that might be happening in over-gripping muscles. So that's going to happen back here. So you can think of the back of your t-shirt or where your low back ribs are pressing against the chair. And you're going to think of breathing into the back surface of your lungs and the base of your lungs. And exhaling naturally. Good. Breathing into the backs of the ribs, the lower lungs, and naturally letting it go. So what you want to be mindful of is that you're not breathing forward or upwards, creating tension in your neck and shoulders or in your back as you're breathing. Your breathing is actually backwards to help keep you full and wide like a cylinder. And then as you exhale, you might feel a little bit of your lower belly or your transverse abdominis, your deep core activating. So as I inhale and then exhale, I can feel that I'm getting a little narrow hollowing, sinking here in my core. So see if your breathing can offer you some support as you stay in this posture. And again, you might be able to stay here for 1.5 hours to 2 hours comfortably, but you might need to change your position after that. But if you're having any pain or discomfort sitting longer than, or pardon me, shorter than that, you might need to reach out to your treating therapist and have them give you a hand with either your position, your propping, or what works for you in order to sit you here comfortably. If you need any help with this, reach out to our treating therapists or give yourself a tips and tricks video to get a little bit more help.